Good morning, all of you. My name is Shreyashi, working as an assistant professor in IIMT College of Pharmacy, Greater Noida. So today I'm going to give the presentation on the topic, and my topic is posology. So firstly, we will know about the definition of posology. What is posology? So posology is the study of how medicines are dosed, and it also depends upon the various factors including age, climate, weight, sex, and time of administration of drug or doses form. Next one is posology, which composed of two words. First one is posos means how much, and logy means science. So it is a branch of medical science which deals with how medicine are dosed to produce its therapeutic effect, and it also depend upon various factors like age, climate, weight, sex, severity of the disease, and so on. So next one is doses for each indication means each method or route by which dose are give or administered and appropriate. So dose recommendation frequency of dosing is in mg per kg once or twice daily or every 6 hours. So next one is we all know that the posology is derived from the two Greek word poso means how much and logos means science. So the final definition of posology is posology is a branch of medical science which deals with dose and quantity of drugs which can be administered to a patient to get a desired action or therapeutic effect. In this, there are many factors which influence the doses. So, next one is factors affecting dose. There are various types of factors are present which can affect the dose. So, in this slide, there are 16 factors are given. First one is age, sex, body weight, route of administration, time of administration, environmental factors, emotional factors, presence of disease, accumulation, additive effects, synergism, antagonism, idiosyncrasy, tolerance, trichophylaxis, and metabolic disturbance. So first we come to the point age. Age is very important factors that can highly affect the dose. So the pharmacokinetics of many drugs challenges with age, like newborn infant, means pediatric. And the dose which is given to the newborn is also known as the pediatric dose. So they are abnormally sensitive to certain drugs because of the immature state of their hepatic and renal functions, by which the drugs are inactivated and eliminated from the body. So the failure to detoxify and eliminate drugs results in their accumulation in the tissue to a toxic level. So whereas elderly patients are more sensitive to some drug effect, as for example hypnotics, which may produce confusion state in them. The next one is sex. Sex is also a very important factor. So, when women do not always respond to the action of drugs as compared to the man, so special care should be taken when drugs are administered during menstruation, pregnancy, and lactation, etc. So, the strong positive, as for example, aloes, it should be avoided during the menstruation. Similarly, the drug which may stimulate the uterine smooth muscle. As for example, drastic positive anti-malarial drugs, ergot alkaloids are contraindicated during pregnancy. So, alcohol, barbiturates, narcotic drug also act on fetus through placenta. So during lactation, morphine tetracycline also avoided because it gave a very bad and harmful effect on our babies. So next one is body weight. What is body weight? In which the average dose is mentioned either in terms of mg per kg body weight, and the another technique used as a total single dose for an adult weighing between 50 to 100 kg. However, the dose expressed in the fashion may not apply in case of obese patients, children, and malnourished patients. So it should be calculated according to their body weight. The next one is route of administration. IV means intravenous doses of drugs, which are usually smaller than the oral doses. Intravenous route, this might enhance the chances of drug toxicity. That's why they are given in small amount as compared to the oral doses. So the effectiveness of drug formulation is generally controlled by the route of administration. The next one is time of administration. The presence of food in the stomach delay the absorption of drugs, and they also rapidly absorb from the empty stomach. But it does not mean that much effective when taken during or after meal. As for example, iron, arsenic, and coal liver oil. They should be also given after the meal, and antacid drugs that are taken before the meal. The next one factor is environmental factors, in which the personality and behavior of a physician may influence the effect of a drug, especially the drugs which are intended for the use in psychomatic disorders. So the females are more emotional than the male. We all know that, and require less dose of certain drugs. Inert dosage forms called placebos, which resemble the actual medicaments and the physical properties are known as the produced therapeutic benefit to the disease like angina pectoris and also as well as bronchial asthma. The next one is presence of disease, in which drugs like barbiturates and chloropromazine may produce usually prolonged effect in patients which have their liver problem, such as streptomycin produced toxic effect on these patients. Their kidney function is not working in proper way because streptomycin excreted through the kidney. The next one is accumulation. What is accumulation? In which some drugs which produce the toxic effect if it is rapidly administered for a long time, as for example digitalis, imetine, heavy metals, because these drugs excreted slowly, and this occurs due to accumulative effect of the drugs. So next one is additive effect, so in which we know about the what is additive effect. Additive effect means when two or more drugs administered together is equivalent to some of their individual pharmacological action. This phenomenon is called as additive effect. As for example, ephedrine, aminophylline in the treatment of bronchial asthma. So next one is synergism. What is synergism? We know that the when desired therapeutic results needed to difficult achieve with a single drug at the time, two or more drugs are used in the combination form for increasing their action, and this phenomenon is called synergism. As for example, procaine and adrenaline combination increase the duration of action of procaine. The next one is antagonism. What is antagonism? In which, when the action of one drug is opposed by the other drug on the same physiological system, is known as the drug antagonism. The use of antagonistic response to drug is valuable in the treatment of poisoning. As for example, milk of magnesia is given in acid poisoning, where alkaline effect of milk of magnesia neutralizes the effect of acid poisoning. So when adrenaline and acetylcholine are both are given together, they neutralize the effect of each other due to antagonism. Because of adrenaline is a vasoconstrictor and acetylcholine is a vasodilator. So next one is what is idiosyncrasy. Idiosyncrasy is also called as allergy. An extraordinary response to a drug which is different from its characteristics pharmacological action is called idiosyncrasy. As for example, small quantity of aspirin may cause gastric hemorrhage, and the next one example is some persons which are sensitive to penicillin and sulfonamides, because penicillin and sulfonamides sometimes produced a severe toxic effect. The next one is water tolerance. When an unusually large dose of a drug is required to elicit an effect ordinarily produced by the normal therapeutic dose of the drug. So the phenomenon is called as drug tolerance. As for example, smokers can tolerate nicotine, alcoholic can tolerate large quantity of alcohol. So the drug tolerance is also of two types. First one is true tolerance and second one is pseudo tolerance. True tolerance include the which is produced by oral and parenteral administration of drug is called as true tolerance, and pseudo tolerance in which produced only the oral route of administration is known as the pseudo tolerance. The next one is was it tachyphylaxis. When some drug administered rapidly at short intervals and the cell receptor get blocked and the pharmacological response to that drug decreased, and the decreased response cannot be resolved by increasing the dose. This phenomenon is called as tachyphylaxis or acute tolerance. As for example, ephedrine given repeated dose at short interval in the treatment of bronchial asthma, which may produce very less response due to tachyphylaxis. The next one is metabolic disturbance. So changes in water electrolyte balance and acid base balance and body temperature and other various physiological factors may modify the effect of drug. As for example, salicylates reduce body temperature in only in case of individual which has rise in body temperature. So they have no antipyretic effect if the body temperature is normal. Then next one is calculation of doses. So there are various formula are given below that can help in the calculation of dose. So first formula is Young's formula, that is the dose is proportional to age, in which dose for child are calculated by age in years into adult dose, which is divided by the age in years plus 12. The next one is Dilling's formula, which is calculated by the dose for child is equal to age in years into adult dose, which is divided by the 20. Next one is Clark's formula, in which dose for child are calculated by the child's weight in kg into adult dose, which is divided by 70. Next one is percentage of adult dose, which is calculated by the surface area of child into 100, which is divided by the surface area of adult. So next one is veterinary dose. What is veterinary dose? The dose required for animal are known as the veterinary dose. So the dose required for animal are more on higher in comparison of human beings, just because of their body weight, say, type are totally changed as compared to the human. So therefore, it is very important for supply the correct dose. Then next slide, in which they are given to the various factors that affect the veterinary dose. So there are 12 points are given below that can affect the veterinary dose of animal. So first one is age, sex, body weight, route of administration, time of administration, various types of environmental factors, the habit of the animals, rate of the elimination, effect of drug on the animals, purpose of medication, various types of species, and character of drugs. So, in this PPT, we can know about the various types of factors that can affect the human dose as well as compared to the veterinary dose. So in this chapter, we know that the posology, which is generally posology refers to the amount of dose that is given to the patients to give their therapeutic and desirable effect. Thank you so much.